Hello, my name is Dr. Carlo Oger. I'm a board certified emergency physician and I make medical education videos like the one you're going to be watching right now. In this video, we're going to talk about the end of year and the New Year resolutions. Here's a graphic to kind of pinpoint how important and what things are important to most people. The number one resolution for 2019 was diet or eat healthier. The second one, exercise more. The third one, lose weight. What does that tell us? That weight and health and the top of people's mind going into a new year. They want to be healthier. They want to do better. And let's talk about obesity, weight gain. How much is too much weight? Well, obesity is a growing epidemic in the United States. 650 million of people worldwide today, and 1 billion people by 2030. Obesity is a serious health condition and is associated with what's called the body mass index. How much you weigh to how tall are you? There's a calculation, body mass index. Overweight is 27 BMI. Obesity is 30 BMI. Obesity is associated with a number of health problems like heart disease, diabetes, stroke, cancer, and so on. It's a driving factor in heart attacks and heart failure, hospitalizations, and the cost of the hospital system. So it is kind of a big deal. So we already talked about how to define overweight versus obesity. And the diseases associated with diabetes, cardiovascular disease, sleep apnea, osteoarthritis from the chronic injury and damage to the joints, and hyperlipidemia. So who is a candidate for medical drug therapy for obesity? Well, anybody with a BMI more than 30 or a BMI more than 27 plus comorbidities. That means diabetes, hypertension, osteoarthritis, sleep apnea, and so on. The weight loss goals should be something that you can accomplish, not these big numbers, but something sustainable. You shouldn't lose more than a pound per week, not more than 5% of your total body weight in 6 months. But if you end up losing 5 to 10% of your weight, you end up decreasing your chance of diabetes mellitus and hypertension. So what are your options for medical weight loss? Of course, there's surgeries. We know about that, but this is about, let's do things that are not as invasive. There is Orlistat. It's a medication you take with every meal. It basically stops the absorption of fat, gives you diarrhea. So the brand name is Ali and Senecal, and it's not the number one recommended weight loss medication at this point. Liraglutide is an injection that is taken daily that has been shown to decrease weight. Then there's Semaglutide, which is an injection done once weekly. There's also phentermine/topiramate, and that's the recommended product in adult males and postmenopausal women. There's also bupropion/naltrexone. This one is not a controlled substance, but it has a lot of contraindications and a lot of potential side effects, including depression and suicidal ideations, and it can cause hyperchloremic anion gap acidosis. So people who are on bupropion naltrexone need blood work every month to make sure they're not getting this complication. So let's talk about Ozempic, the one people are talking about. Now, Ozempic is the brand name. The actual drugs is called semaglutide, and it's a GLP-1 agonist. These can be given subcutaneously once a week or daily orally. Now, orally is not approved by the FDA for weight loss, but it is being used off-label for that purpose, and it actually has been shown to decrease weight. There is objective clinical data that semaglutide, Ozempic, does result in significant weight loss compared to other forms of weight loss. But in order to maintain the weight loss, you must do the therapy for at least a year and do true lifestyle changes. If you don't change the way you're eating, when you stop the medication finally, you're slowly going to gain your weight back. So the Ozempic, with changes in diet and habits and lifestyle changes, will result in significant weight loss. But there are other positive benefits of Ozempic. It's been shown to decrease cardiovascular disease prevention, and especially patients that are diabetic, like cardiovascular disease, heart attacks, strokes, and so on. And in a small study of people who had alcohol dependence, it was shown that those people actually that were also taking Ozempic did have a decreased amount of urges to drink alcohol. So it seems to help with all kinds of urges and decrease potential addiction type physiology on these patients. Now, there is a warning. Ozempic is not for everybody. It will cause GI upset. It's kind of how it works. It makes you feel like you're full all the time. Some people that becomes nauseous, some people become vomiting, some people will have diarrhea, and that obviously causes less nutrition, less calorie intake, more calorie output through the diarrhea and so on because of the malabsorption, and therefore people lose weight. It should not be used in pregnancy or people trying to get pregnant, people who've had pancreatitis, because it can cause pancreatitis, and especially if there's history of thyroid cancer, not just on the patient, but family history of thyroid cancer, as has been shown to increase the chances of thyroid cancer. So, if you are one of these people, has one of these warnings or contraindications, do not consider Ozempic. So what is the dosing? It's once per week. It starts at 0.25 milligram injections. Then you do that for 4 weeks, and every 4 weeks you go up to 0.5, 1, 1.7, and then 2.4 milligrams. It's the ideal dosing at max for optimal weight loss. Some people can't tolerate that. You have to move back down. Now, we did talk about the oral version of semaglutide that is given every day, but is actually not approved for the purpose of weight loss by the FDA. Now, there's another medication who's a dual GLP-1 agonist and a GIP. GIP stands for glucose-dependent insulinotropic polypeptide, and that is tirzepatide or Mounjaro. Now, Mounjaro has been shown to be even more effective than Ozempic at decreasing weight loss. The bottom line, it is more effective. The dosages are different, 1, 5, 10, and 15 milligrams, but there is increased side effects. Makes sense. More side effects of nausea, satiety, diarrhea. Means less people are eating or accumulating calories, right? What is considered a failure of the weight loss? Well, if you don't lose at least 5% of your weight on the medication, then after 12 weeks, you should taper off and discontinue the drug. It means you have failed. So, what did we learn here? We learned the definition of overweight versus obesity, which obese patients can benefit from Ozempic or Mounjaro. Obviously, those that have comorbidities and a BMI of 27, or everybody who is above 30. Now, this medication is essential and needed by people who are diabetics for control of sugar. But now it's being targeted and promoted as a weight loss. And because it works so well, it's basically sold out everywhere. It's hard to find. So people who actually need the medication for diabetes control sometimes have to wait because all the people who are using strictly for weight loss are buying it out. It is an extremely expensive medication. Without insurance, you talk about thousands of dollars a month for the Ozempic and more than $1,000 a month for Mounjaro. There are some clinic pharmacies that are starting to produce what is called compounded medicine and will provide this medication at a discount. If you are interested in learning more about getting compounded Mounjaro or Ozempic, of course, the generic versions, send me a message and I will give you more information about that. These pharmacies, as long as you have a medical prescription, a doctor evaluation, a doctor is going to monitor you, follow you up, they will send you the medication to your home at 30-day intervals. So the new year coming around, new year resolutions, you can start strong and get this medication. Now, cash payment, these compounded pharmacies can get it to a fraction of the cost. This particular pharmacy I learned about just recently can give the medication somewhere around $300 per month, which is a significant decrease in cost compared to $1,000 a month buying it off a regular pharmacy. And not all insurance will cover the medication. So the first thing you need to do is call your insurance carrier and find out if they will cover the medication. And if they say they will, ask them what the pre-approval process, because they will have the doctor call them and get pre-approval, and they won't approve you because you haven't tried metformin first or because you don't have adequate BMI, you don't have comorbidities. So you have to have those things to get approved via pharmacy. But if you're willing to pay cash or just pay on your own for the medication, there's a number of boutique pharmacies and clinics who will send you the medication after a medical evaluation over telemedicine, a prescription written to you, and that can be sent out. If you want to find out more about that, send me a message, whether through YouTube, through Facebook, through messages or whatever, and I can provide you some more information about getting either Ozempic or semaglutide or Mounjaro. All right? So I hope you learned today about these medical treatments. They are extremely effective. People are having tremendous results on these medications. And again, the impact it can have on decreased cardiovascular risk, hypertension, stroke, even as you can see, some addiction syndromes as well. So check it out. Please comment. Please send me messages. What do you want to hear more about these medications? What questions do you have? And I'll do my best to answer those for you. See you on our next video, and good luck with your New Year resolutions.